We've lost some markets this year, and the Aetna withdrew from the individual market, and then we had Assurant pull out nationwide. So there was nothing we could have done about that, which brings us down in the individual market to Premera and Moda.
As the largest health plan in the market, we want the Affordable Care Act to work. But right now, there are some challenges in terms of how sustainable the increase in medical costs are over time. Premera is the largest health plan in the individual market in Washington State, both in the exchange and out, same in Alaska. We are losing money in the individual market, a lot of money, in fact. And what we're seeing is that's not just us, it's health plans across the country are experiencing the same thing. But it's a trend that policymakers are going to have to start paying attention to.
The funding that accompanied the Affordable Care Act, which provided a lot of bridge financing and things to make the transition, are one-time events and are gone or going away in the coming year. So I think we need to have a serious discussion with all stakeholders about what is the funding formula to sustain this program in the long run.
Obamacare has moved us forward and changed the face of healthcare. On the other hand, as we add people, we have enormous expense. And particularly in Oregon, I'm concerned because the roll-up costs are going to be very, very substantial. And that impacts our budget and impacts schools, which, for example, are already underfunded, and we have the second lowest graduation rate in the United States. So that competition, I think, provides some really tough discussions and some very hard decisions.
I think as you look at an environment where utilization is really flat or not growing, and price pressure from all payers exists, it's going to be increasingly difficult in rural areas to sustain services.
Alaska, as you know, is a really small population but large geography. Specialists aren't going to live in a community of 1,000 people or 300 people or maybe not even a community of 6,000 people.
We're also watching the mergers of 4 insurance companies nationwide into 2 and how that is going to impact Alaska, particularly as we're looking at possibly bringing other insurers into Alaska. The more that merge, the smaller the numbers there are for me to go out and try to get to come up to do business. You know, there will be insurance companies here. I would like to see more, and we are working hard on trying to get more. The more insurance companies we have here, the more competition there is, the better it will be for all of us.
Healthcare is such a complicated issue. On one hand, when you're trying to find solutions, oftentimes it's easier to just take things one step at a time and make some incremental progress. But taking a hard look at what's going on in the individual market, whether that's in this legislative session or the next, is probably going to be a good idea.